Another thing, it was found that almost 90% of all females who have a diagnosis of fibromyalgia have a history of a whiplash type of an event, or what we call an acceleration-deceleration injury. And this led an MD named Andrew Holman. Actually, a lot of his research started in the early 2000s. Found what he calls positional cervical cord compression. And what happens is when you have, whether it's some type of a car wreck or you fall off a chair or whatever it is, you get a whiplash type of an injury and it creates a functional compression in the spinal cord. As an example up here, the dark line running down here is your actual spinal cord. And these over here are the vertebrae and the discs. You can see as this person goes from a neutral forward-looking position to an extension position, you can see here that the discs are pinching off the cord, right? If you're just to take them normally, there's nothing. Now the problem with this is that it's well known from a neurophysiology perspective that it only takes the weight of a dime to reduce nerve conduction by 60%. Obviously a dime doesn't weigh a whole lot. So it creates, a very light pressure on the nervous system or any nerve can create a lot of interference and a lot of pressure. And so of course what this does over time, and the reason why it causes fibromyalgia, is because over the course of time if you keep stimulating a nerve over and over and over again, there's a law called Sherrington's law that says the more you stimulate a nerve, the easier it is to stimulate that nerve. And so now all of your nerve endings become hypersensitive. So over time, that person begins to feel pain from different things that shouldn't normally be painful. Whether it's putting something cold on the hand or pressing a little bit hard. Those types of things to most of us shouldn't be painful. But if the nerves are hypersensitive, everything feels painful. Well, the trick is to not dull the nerve endings like Lyrica and some of the other prescription medications. You have to fix that. Or you have to find the source of that, those nerve endings becoming hyperexcited. And actually, even in a lot of cases, it's opioid medication. Most people don't realize oxycodone and Vicodin, a lot of these opioid medications, actually hypersensitize nerve endings. So they're actually, it's almost like this medication creates its own necessity. Think about it.
So why don't pain management doctors know this information?
Well, I don't doubt that they do know it. I just don't know if they really say, well, that's great, but what do I do about it? A pain management doctor doesn't really have, unless you're going to refer that person to a surgeon for surgery to repair a disc herniation or whatever else, they may say, I don't really have any options for it. We can do an epidural injection or we can do whatever else to try to put a steroid in the area to lessen the inflammation, but they really don't have a whole lot of options treatment-wise. But that's true in my opinion, that's true in conventional medicine in totality. Conventional medicine is very good diagnostically and very inadequate from a treatment perspective. Most alternative medicine is actually the opposite in my opinion. It has less to offer diagnostically in some cases, but more to offer treatment.
So if, let's say, if somebody is taking opiates, they're treating with a pain management physician and they're taking opiates, and they're at a certain level on the opiates, and all of a sudden they're getting increased.
Exactly. You don't ever see them go down, do you?
No, but
right.
The increase didn't help. The pain just got worse.
Well, absolutely. It was chasing it. That's absolutely true. It's a dog chasing its tail when it comes to opioid medication. Absolutely. Now, as an example, a lot of times what we see, and you can see it in this MRI, when you look at somebody from the side, of course, I apologize, the person's looking in the opposite direction, but there should be a nice forward curve in the neck. You can see here, this person doesn't have one anymore. It's literally straight, right? This normal curve in the neck is important to keep the spinal cord running behind it in its normal position and functioning normally. If you lose it, which is essentially what happens when you tear some of the ligaments on the front or back of the neck, like in a car accident, now there's no support there. And literally, to go from this position to this position stretches the spinal cord by about 25%. Now, you guys are all familiar, remember as kids you had those Chinese finger trap things where you put your fingers in the end and you pull and you can't get your fingers out? Well, that's actually called Poisson's effect. What happens is, as you pull, you notice the middle of the Chinese finger trap gets smaller, right? If you can picture that in your mind's eye, I wish I should have brought some. I think at the dollar store. But You pull them apart, the middle gets narrower, and that's exactly what happens to your cord. As you stretch your cord vertically, it gets narrower in the middle. Well, if I were to look at the spinal cord, it basically is like a cable wire. It has a lot of nerve tracks that run through the spinal cord. If I compress that space, now all of those tracks get compressed. And the neck is the only where in the body where, I can have a problem in my knee and only affect my knee. If you have a problem in the spinal cord in the neck portion of your spinal cord, you're going to have a problem systemically. That's just as an anatomical fact. So it's very important then to take the steps to take a curve when it's not normal back to normal.
You can reverse that?
Mm-hmm. In fact,
No one's ever said that.
when I first opened my practice in 2002, the first thing I did is I went to, there's a doctor at Genesis, Avery Jackson, who's a neurosurgeon. He was the first doctor I ever met locally, and I had only went to him because he had opened almost within months of me, and we're almost the same age, and so he's a younger guy. Most younger doctors are more open to at least listening to information. So I went and I brought in some of these before and after x-rays that I had done on some of my patients already. And this is a neurosurgeon, and to this day he's a very prominent neurosurgeon in the area, and he actually tries to do minimally invasive technique. And his quote to me was, "Well, I didn't know you could do that non-surgically." And so all of my initial practice was just this. It was literally just taking people whose necks and backs were structurally not correct, like a square wheel per se, and make it round again. And of course what happens a lot of times is they'll get the person like this, they'll do like a 2 or 3 level fusion, and then it still doesn't restore the curve, so the fusion might help for a few months or a few years, but then they just hurt again. And so that's when he was sending all those people to me, because of course they're all coming back saying, "I'm hurting again, this and this and this," and so I don't want to do another surgery on you because the first one didn't really help. So then those are the people I started getting.
So you do that with manipulation? Do you
No. Actually, manipulation does not make structural changes.
How do you do it?
There are very specific spinal rehab techniques that we use that kind of retrain all the musculature to support the normal shape. Obviously this is not just a stack of bricks, so you have ligaments and muscles attached to it. You have to retrain all of that to hold the correct position, otherwise you have no chance of getting the curve to go back to what it was. You might be able to do it with manipulation for very, very temporary periods of time, a day, 2, 3 days, but it's just going to go right back to that if you're not stabilizing everything.
So is it just like physical therapy, basically you retrain your muscles?
Well, it is a form of physical therapy, let's say. Physical therapy is very broad in a sense. Most everything we do is stuff, we actually call them smart exercises, or active reflex exercises, which is we do things to the body to make the body automatically assume a better, more corrected position. And they're things that most people don't think about, like wearing weights on the head or shoulder or hip to cause very specific postural changes. And we actually x-ray them with that gear on to verify that it's producing the effect we want. Then they wear a lot of it at home. We follow up with them in clinic periodically, and it makes these changes over time.
Pressure pump is very helpful.
Well, that's part of it. That's a warm-up procedure, sure. But this is Dr. Holman's theory. Again, it's called positional cervical cord compression. So anytime we have fibromyalgia patients, this is one of the first areas that we look at for them, specifically knowing the data that 90% have a history of a whiplash injury.
This is just blowing me away.
So now metabolic treatments for fibromyalgia. Iodine is one, and I'll explain why in a minute. D-ribose for energy, melatonin, and cannabis over here for sleep. Omega-3 fatty acids for anti-inflammatory properties. And SAMe and TMG, which are methyl donors. SAMe is for pain as a result of depression or anxiety. It also is very important for people who do have that methylation defect that I mentioned earlier, to help them detoxify the body better and not have the heavy metal consequences associated with fibromyalgia. Iodine we use quite a bit, but you have to use it judiciously. there's a theory, and of course Dr. Brownstein has spoken for Rebecca before here in the area, and Dr. Brownstein is a very big advocate of using iodine. And the reason being is it's been found that there are very specific disorders, fibromyalgia being one of them, polycystic ovaries being one of them, thyroid goiter or hypothyroidism also being one, that are all linked to iodine deficiency. And of course one of the theories behind that is, again today, in the latter decades, in our breads, as a primary example, we have taken out the iodine that used to be fortified into it and have replaced it with bromide. The problem is bromide actually pulls iodine out of your system. The problem also is further in today's age that a lot of our citrus sodas are flavored with brominated vegetable oil, which also pulls iodine out of the system. So give me a person that comes into my office with PCOS and give me a person who isn't drinking 220 ounces of Mountain Dew every day, probably. And so again, we have to obviously make the dietary change if you want the long-term fix. But secondly, you have to get iodine back into the system. The caution is if somebody has autoimmune thyroid problems, iodine is an essential component of thyroid hormone. So if you have antibodies to thyroid hormone, you can't take iodine or it will cause accelerated destruction of your thyroid gland. So you have to intervene with it in a very timely manner along the treatment cycle to get it to work right. Because even with people who have autoimmune, we'll still need it at some point. It's just a lot of times you see people take the stuff right away and they take mega doses of it right away, way too early, while their antibody count is still incredibly elevated.
Is there a substitute if you have an allergy to
Or if it's been
iodine?
proven in the past, is it lifelong, that allergy to iodine, like shellfish?
That's a great question. Actually,
And you still know you need it?
if you still know you need it, what it's going to have to, we still treat that individual as if there are other gut lining issues first, and then revisit them. Because even if we can't get them to tolerate shellfish, as an example, there still may be things that person can tolerate, like kelp or seaweed in its raw form, that have naturally occurring iodine in them, at much lower quantity. But it depends on that individual. Okay, this is a neurotransmitter profile. A sample neurotransmitter profile. In this case, this person is low on serotonin, 5-HIAA, and GABA. Serotonin, as we mentioned, is one of the primary means of, or one of the primary hormones responsible for a normal sleep cycle, and it's also responsible for depression. If you don't have enough serotonin, it's more likely you are to have depression. So of course, what do people take? Antidepressants, which are called selective serotonin reuptake inhibitors. An SSRI is, what it does is it takes the existing serotonin you have and it forces your body to recycle it and reuse it multiple times before then the molecule gets degraded and absorbed back into the system. The problem is, if you're on an SSRI and your serotonin is in the tank, what is there to recycle? Does that make sense? So you still have to be on something to get your serotonin back up. Once you can get a track record of getting your serotonin back up to normal levels, then the person can be weaned off of the SSRI and never hopefully have to go back on. GABA is another big one that's it has multiple functions, but in terms of just emotional health, it's also very important for just a general sense of well-being. And in this case, this person's is low also. We talked about stress hormones. Norepinephrine and epinephrine down here are your adrenaline hormones. Glutamate is something that is very excitatory and very detrimental if that becomes elevated, which it often is. Glutamate is going to be MSG, foods with MSG, or I think there's like 11 different names that companies use to try to avoid saying that there's MSG in their particular food. Autolyzed yeast being one. There are mono and diglycerides. I forget all of them, but sometimes I just want to just grow on my own. But histamine, which also gives us an idea of underlying food sensitivities or environmental sensitivities. And then, of course, dopamine here as well. Dopamine is going to be important for us as a, we see this depleted a lot in people who have had long-standing autoimmune thyroiditis or Hashimoto's thyroid. In fact, there are some researchers that believe that people who are developing, we're seeing Parkinson's at a much more frequent scale today. And the reason a lot of people think is that once your thyroid gland has been literally destroyed by your immune system moves on to the next organ, and it happens to be your midbrain where dopamine is produced. And so then, as these dopamine receptors are destroyed, dopamine levels are not manufactured anymore, you develop symptoms of Parkinson's. And it's still an autoimmune response.
Or dopamine, could be restless leg syndrome.
It can be, absolutely, absolutely.
What about seizure disorder?
For neurotransmitters? Well, it's going to depend. Seizure disorder to me is more of a heavy metal thing that I notice. It's not necessarily autoimmune, which is a lot of what we're checking when we check this. We see a lot as heavy metal or pesticide exposure combined with some other type of a food sensitivity. For example, we had it's a family of a staff member who has a seizure disorder. And the basic things we did for him was we chelated him, first of all. Second of all, he does some very specific neurological exercises to increase the threshold in that specific area of his brain where he has a seizure. And he's gone seizure-free now for, I forget how many years. And he was having them on a monthly basis. Just a little petit mal seizures, but still seizure nonetheless. So. Auto, yes. Yep.